What is TACE or a tear procedure?
So in the TACE procedure, what we do is we'll put a small tube in the leg and the tube will take it inside the liver and give a chemotherapy or radiation therapy to the tumor. So what happens, there will be a maximum concentration of the chemotherapy drug in the tumor and very little chemotherapeutic drugs goes to the body. This will give rise to maximum dosage to tumor and with a minimal side effects. In the transarterial chemoembolization, we give a chemotherapy through this tube, and in the tear, where transarterial radioembolization, we give radiotherapy through this tube.
Which subset of patients are ideal candidates for this kind of management?
Hepatocellular carcinoma, and also to these like some of the cancers, metastatic cancer from colon. So those cases which are not eligible for the curative surgeries, or we can treat those cases with these kind of procedures.
What are the current guideline recommendations supporting the management of hepatocellular carcinoma by endovascular management?
Cases which is not operable or not ablatable, or the cases which actually suits into this category of the treatment. So this is a minimally invasive procedure with a short admission time with maybe around 3 days and with a minimal side effects.
How is this beneficial in comparison to the conventional surgical alternate?
Not an alternative to surgery. We cannot compare this procedure with a surgery because the indication for surgery and indication for this procedures are totally different. Generally, those are the candidates which are not suitable for surgery are referred to this kind of treatment. Still, this is a very, very minimally invasive procedure which has only few millimeter cuts in your leg and only very brief period of admissions, maybe 3 to 4 days of admissions, and with a minimal side effects, and almost we can say no scar surgery.
What is the message you want to give to the general physicians about managing the patients in their OPD after the procedure has been performed by an interventional radiologist?
After the procedure, actually we don't expect much complications. Generally, there will be whatever the complications happens, it will be post-embolization syndromes are very minimal. Patient can get some kind of fever, which is normal, and not to be confused with some infections. And patient can have a loss of appetite, that is also normal. It will subside over a period of time. And after the procedure, generally we follow up the patient with either alpha fetoprotein blood and also imaging either with CT or MRI. Generally, we repeat this procedure if required at the 1 month interval. If it is not required, no repetition is required. Generally, we follow up the patient every 3 months.